There's a probably more than good chance that what's going on here is more like a partial cruciate tear. Okay, and the reason I'm saying that is because of his presentation, his age and breed, the thickening on the inside of his knee, and the fluid buildup on the x-ray. You have 4 ligaments. You have 2 ligaments that cross in the middle on the inside, and a straight ligament on either side. These are the collaterals, and the ones that cross in the middle are called cruciates because of the X that they make. Okay? So football players, soccer players, skiers, they blow out their ACL. And in dogs, they walk on 4 legs, and we call it a cranial cruciate ligament instead of an anterior cruciate ligament. Okay? It's the most common orthopedic injury probably that we see in dogs. Typically, we diagnose it by characteristic changes on the radiograph, but instability in the knee that we can feel on our physical exam. Okay. What I'm going to tell you about him is I'm not 100% convinced. What I would like to do is, because he's not absolutely reading the textbook straightforward and a very straightforward cruciate tear, I would like to sedate him, evaluate the knee sedated, and get some fluid from that. We can test the fluid and make sure it's not an infected joint, make sure it's not a highly inflammatory joint. If there's a lot of white cells here, then what it's going to say is that she has more like an inflammatory polyarthropathy, so involvement of more joints, and that we need to focus on that rather than instability in the one knee. And there are white cells all over the place here. Hi, Ms. Warlick. It's Dr. Hinton. I just wanted to go over a couple of things with you about Sparky. Well, first of all, he's doing fine, waking up from the sedation. But on the exam of the sedation, I was able to get a small amount of instability in the knee, but still not completely classic that I would see with a cruciate ligament tear. We got a fair amount of fluid in the joints that was pretty thin, which usually indicates can be more of an inflammatory process, because joint fluid should be like consistency like the oil in your car. You know, it should have some viscosity to it, and if it's too thin, it's not doing its job. When we see a lot of white cells, particularly in more than one joint, we basically have to determine whether or not we have a bacterial infection in more than one joint, or we have an inflammatory process in more than one joint. We ultimately decide if it's an infection, we put them on antibiotics. If it's not an infection, typically where we end up having to treat these is put them on something like steroids. If I don't catch you, or you haven't heard from me Thursday afternoon, please don't hesitate to call and either have them page me or leave a message, okay? All right. No problem. Bye-bye.